almost a year on, is it time for another precaution dose? What do you think?
So I think as we move forward, we need to, and we talk of precaution dose, we need to have two data sets with us. One is, what is the degree of immunity in the population? Is it waning? Possibly it is, because COVID cases are not as much as we were seeing in the past, but we need more data on that. Secondly, what type of vaccine do we need? Do we need to tweak the vaccine? Currently, the vaccines that we have in India are covering for what was the original strain, the Wuhan strain. After that, we've had so many variants.
Correct.
And therefore, if we have to have a new vaccine, it should cover for the circulating strain, like we do for influenza. So if we have to have a new dose of vaccine, a new booster dose, we should be sure that it is going to protect us with from the current circulating strain rather than the old and the emerging variants. So I think what we need to do is research in developing vaccines which will cover not only the current circulating strains, but also be able to cover the emerging variants which may emerge over the next few years.
Is COVID now endemic?
So in my opinion, COVID has more or less become endemic. We have a good amount of immunity. Cases will continue. It is not a disease which we'll say it's going to finish.
COVID is going to be here.
It is going to be here, and we will continue to have some waves of cases coming and going, but it's not going to cause the type of waves that we saw in the last 2 years. A few cases will be there, and we will have to learn to live with it.
It has been almost 3 years since the start of the pandemic, and new variants keep appearing. So how prepared are we to deal with any future challenges?
So I think we are better prepared than we were in the past, because we have learned a lot from COVID. The challenge, of course, is that whatever we've learned, we keep implementing that as we move forward, and the memory of COVID becomes, let's say, lesser and lesser. Because this is a century that we've seen a lot of outbreaks. The last 23 years, we've had a large number of outbreaks. We've had two pandemics, the swine flu or the H1N1 pandemic and the COVID-19 pandemic. We've had outbreaks of SARS, MERS, Zika virus, even Ebola outbreaks. In India, we've had outbreaks of Nipah virus, also an outbreak of monkey flu. So if you look at the last 23 years, we've had a number of outbreaks. And therefore, we should learn from what we've seen in the last 2 decades, that we need to prepare. And the preparedness has to be in the sense of good surveillance, an action plan. So how do we upscale our health facilities, both in terms of human resources and infrastructure? But I think the most important thing is also that it doesn't disrupt the other day-to-day management. One of the sort of, I would say, downside or the collateral damage which we saw in COVID was that a lot of other diseases, cancers, tuberculosis, other infections suffered a lot, because the focus was only on managing COVID-19, and we were not able to manage these illnesses in the outbreak. Patients with cancer were scared to come to the hospital, and the cancer which was in the early stage came into an advanced stage. People who had tuberculosis were not being diagnosed at the right time, or treatment was not being provided. So we must develop a strategy where we can manage the outbreak, but at the same time our health systems and planning and policy and programs continue to suffer, or continue to work and don't suffer.
Is COVID now endemic?
So in my opinion, COVID has more or less become endemic. We have a good amount of immunity. Cases will continue. It is not a disease which we'll say it's going to finish.
COVID is going to be here.
It is going to be here. And we will continue to have some waves of cases coming and going, but it's not going to cause the type of waves that we saw in the last 2 years. A few cases will be there, and we will have to learn to live with it.